Elishma, thank you. Well, when your child gets sick, you might want a doctor to give them an antibiotic. But some say not so fast. A new study shows Tennessee's children are being overprescribed. News 2's Corey Johnson reports that could mean consequences for all of us.
Doctors use antibiotics to treat bacterial infections, but more than 2/3 of the time, new research shows children are getting a prescription that does not follow guidelines. Tennessee's Department of Health and Vanderbilt University Medical Center helped with the research.
And what this study shows is that we still have a way to go. We're not yet at an ideal situation. So we have more work ahead of us. And that involves not only the medical professionals, but also our patients.
Researchers studied the treatment of nearly 500,000 children in the state. They found 39% of antibiotic prescriptions were for illnesses that rarely require one.
If you're taking antibiotics and they're not necessary, you subject yourself only to the adverse side effects. As we overuse antibiotics, the germs we're trying to kill actually develop resistance. The antibiotics won't work anymore because these germs mutate in a way to evade our antibiotics. And that means going into the future, we'll have fewer antibiotics available to use when we really need to use them.
Alternatives to antibiotics are top of mind at Sanctuary Functional Medicine in Franklin.
If you have 104 fever and raging pneumonia, antibiotics are very appropriate. However, we will try to limit those antibiotic uses to only those that are absolutely necessary. How many antibiotics has your kid had? Which is one of the main questions we ask when we're starting to see someone. 5, 10, 15 courses of antibiotics over a number of years.
Medical Director Dr. Eric Potter says their clinic looks at ways to support the immune system and help the body recover naturally.
We're going to be doing things that are going to cover, if they have a virus in their nose, if they have a virus in their lungs, things that are going to support their immune system for 20 different viruses or 20 different bacteria.
Doctors urge parents to work with trusted physicians, even if they're not quick to prescribe an antibiotic.
When you have a cold, when you have a middle ear infection, or your child does, or you have acute sinusitis, for example, be aware in many of those circumstances, in fact, in the majority, antibiotics are not necessary.
Corey Johnson, News 2.